Good morning, everyone. I am Rahul Ranuhal, COO at Cureka.com. Today, we are having our Instagram live session with Dr. Pathumai on the topic of sensitive teeth and oral hygiene. Before going on to and speaking to our guest today, let us review what is Cureka. Cureka is your online healthcare platform which has got products from skincare, hair care, nutrition, wellness, elderly care and pain management. It has got 450 brands and 6,000 plus products to choose from. So log in to www.cureka.com and find the right products for your concern and to live a healthy life. So let me not take much time and introduce you to the guest of today, Dr. Pathumai. Dr. Pathumai, please welcome. Thank you so much for giving us your time today. And the topic for today is sensitive teeth and oral hygiene. A few words on the topic.
A few words on the topic.
Yeah.
Sensitive teeth is a very common problem which all of us face.
Yeah.
It can affect any age groups,
Mm-hmm.
right from youngsters who have very harsh habits of teeth biting and very hard brushing, to older people.
Mm-hmm.
So generally, more problematic people are the elderly people who have general wear and tear of the teeth, because of which they are sensitive. Tooth is sensitive. So this is a global problem today, and let's see.
True. So doctor, we have got some questions from our guests. And the first question is, what is actually the sensitivity of the teeth?
So sensitivity is nothing but a short, brief, sharp pain which you feel in your teeth. So when you have something hot or cold, or when you speak, when a cold air or something is blown into your teeth, you feel a sharp pain.
Mm-hmm.
This pain is called dental hypersensitivity, provided you do not have any dental pathology of the teeth itself, like the caries or any other problem.
Mm-hmm. Understood. So why sensitivity occurs in the teeth, doctor?
Okay.
And to what age groups?
For age groups, generally everyone do have sensitivity.
Mm-hmm.
With the elderly being more affected because of general wear and tear.
Mm-hmm.
So coming to why a sensitivity occurs, it's necessary for us to know about structure of the teeth itself.
Yeah.
So generally the teeth is made up of the part which we see outside. The crown portion is made up of 3 layers. The enamel, which is the most protective layer of the tooth, and it acts as a shield. Beneath the enamel is the dentin, and below it is the pulp. The pulp contains the vital cells and blood vessels, everything, and they extend into the dentin through some tubules or pipes called dentinal tubules. So the enamel is the overall protective covering of the tooth itself. So when this gets damaged because of some rough habits which we have, or because of daily wear and tear, then the shield is broken down and dentin is exposed, and we get dental hypersensitivity. That is what happens. So some conditions that itself can cause the wear of the enamel would be dental attrition because of the age. On youngsters, they have the habit of clenching the teeth.
Yeah.
So that is called bruxism. That can have an occlusal wear.
Okay.
The wrong brushing habits, using horizontal strokes, brushing the sideways like this, can have detrimental effects on the enamel. You can have saucer-shaped effects on the sides. So that is called as an abrasion.
Mm-hmm.
Then finally, there's something called erosions.
Mm-hmm.
So especially when we have very acidic foods without diluting them.
Mm-hmm.
Or some people may have gastric regurgitation,
Mm-hmm.
acid reflux.
Mm-hmm.
From the stomach to the oral cavity, they may have acid popping out. So such people tend to have more of erosions and sensitivity.
Right. Now when you're told about different age groups of people, right from the kids to the adults who might have sensitivity, any kind of a lifestyle practices that may cause some sensitivity in the teeth?
Yeah, more erosive beverages, more erosive food intake can definitely cause dental hypersensitivity.
When you say erosive, so let me make it easier for the guest. Would it include some junk food and all that would?
Junk food and junk beverages.
Junk food and junk beverages. Okay. That's why mom and dad and doctors always say avoid junk food and beverages and have healthy fruits and vegetables. So now moving on to our next question: what to look for in a toothpaste for sensitive teeth?
Okay. So when coming to toothpaste for sensitive teeth, since I've already talked to you about dentinal tubules, so right now there are two types of this actually covers the treatment of dentinal hypersensitivity. So through the tubules, when there's a fluid shift, we receive a signal from the pulp, so which is called as dentinal hypersensitivity. So one thing is you block the tubule or the pipes itself. So there are toothpaste which contain agents that block the tubules, and there are toothpaste which desensitizes the nerves, so that the signal is not sent to the brain. So there are two types of toothpaste. Over the counter, you can buy any one of them. Both are effective. Generally, arginine containing toothpaste are said to be more effective than other.
Understood, doctor. So guys, if you have got any questions for us, please do write in the comments and we will take them in this live session. So we have got a question coming in from our guest. Her name is Rahila Rajendran and she says, I am anemic and one of my teeth incisor in lower jaw is breaking down into small pieces on the crown, leading to sensitivity. Any home remedy to avoid? Do I need calcium supplement?
What age is she?
Her age is 33, she has mentioned, and she says, I already take iron, vitamin C and folic acid.
Okay, that should be sufficient. Home remedies, like if it's already started breaking down, then you cannot regrow it. You should actually visit us. For the sensitivity, you could go with over-the-counter sensitive paste, but still, it's better you visit us and we suggest you what has to be.
Understood. So go visit your dermatologist and they will be the best person to guide you into what kind of a foods or any supplements you may need, right? So now next question is what to look for in a toothbrush. Tooth bristles are also very important for sensitive teeth. What to look for in a toothbrush for sensitive teeth.
Okay. Toothbrushes, they have we have so many ranges of toothbrushes. They come in hard, medium, soft, ultra soft and sensitive.
Yeah.
So it's better we avoid the hard bristles, hard and medium. For sensitive teeth, it's always recommended we use ultra soft or a sensitive type of brush with the rounded bristles.
Rounded bristles. Okay, understood, doctor. So moving on, now the question comes for the listeners, how to treat sensitive teeth and when should you go and consult a dentist?
Okay. So then we first initially we saw about over-the-counter dental treatment, which included toothpaste and the mouthwashes are also available. When you feel that they do not work, or when you see that the attrition or the abrasion is very severe, which results in continuous pain and you cannot do your daily activities, that is when you need to visit us. So when you come here, we may check your tooth and we may check your teeth and we may prescribe you professional paste which has to be used. Or we can even use varnishes. We have fluoride varnishes, resin-based materials, and glutaraldehyde methacrylate combination solutions. These have a faster relieving effect than the over-the-counter toothpaste. So when you use toothpaste, it may take at least minimum 2 to 3 weeks to see notable results. But when you come to us and we use the HEMA, glutaraldehyde HEMA solutions and all those, the relief will be very fast.
Right.
And we will also assess whether just a hypersensitivity treatment is enough or the teeth itself has to go for another set of treatments or root canal or other things. We will assess according to your severity.
Right. So in general, a lot of times people have got a question in their mind that, when should they consult a dentist? Like sometimes you have got different tooth issues, tooth decays are there, or yellowishness in the tooth is there. Yes, sensitivity in the tooth is there. But in general, people do periodic diagnostic tests for their body, but I think they take a back step when it comes to dental health care. So when should they go and see a dentist?
It's better they visit a dentist every 6 months.
Every 6 months.
And if they have any problem, frequency of problem is there. If they have a sudden sharp pain in the tooth or sudden bleeding gums, then it's better they can even see us before that.
Wonderful. Go and see a dentist every 6 months periodically, so at least you get to know whether your teeth are in good condition. And guys, we have got a WhatsApp platform on Cureka.com where you can ask your question, your concerns, or any product recommendations, and our healthcare experts will come back to you within 24 hours. We've got another question coming in from our guest, whose name is Selvam. He says, my child is grinding his teeth during sleep whenever he has cooled specifically, and he is 5 years old. Other days he doesn't do that. Do I need to consult a dentist?
Yes, you need to. Because this night grinding habit is what is called bruxism. This can result in general wear of the tooth. So it's better you visit a dentist. And according to the age group, we will prescribe the treatment. Maybe we'll just assess whether he's stressed or whether it's just a habit which he has. Depending on that, we may give him mouth guards, night guards.
Understood. So that will avoid the erosion in the teeth.
Because the stress itself from bruxism can result in joint pain.
Understood.
So this temporomandibular joint can result in pain.
Right.
Hence, has to be done.
So a question would come from the people's mind that does stress also come in that age group, 5-year-olds?
It doesn't.
Yeah, but
it should be some other psychological related.
See, at every age group we have got some challenges, right? Everyone is getting, so I believe.
Maybe he is finding it difficult to at school too.
Yeah. So go better see a dentist for this solution if you've got grinding of the teeth in your kids. So the next question that we have today with us is how to prevent sensitivity of the teeth to occur. How can we prevent?
So generally, if you the first thing would be, I think we previously covered it, the bruxism thing, and then the wrongful brushing habits.
Yes.
So when you have a wrongful brushing habits, you have to avoid it. Always use a soft or a sensitive. I mean, it's better to use a soft bristle brush, and never use a horizontal stroke with heavy pressure. So that is what causes erosion. I mean, damage to the enamel. Avoid using that. And avoid having or drinking any acidic foods, undiluted ones, especially even fruit juices when they are not diluted, they cause erosion. And after having acidic foods, do not brush your teeth immediately. And what is more important is whenever you have something stuck to your gums, there's a habit among general public that they use toothpicks or pins or to take them off. So that itself will cause the damage to the gums. And that can cause gum recession. So even because of gum recession, you'll have sensitivity. So that will be that.
So in that case, what would be the recommended, doctor, if in case something people
use of proper interdental proper means like when the gap is very small. If you're going to use a bigger interdental brush, then it's going to damage your. So it's better you visit us and we will let you know. And flossing is another technique where you can remove interdental clogging.
Right. Thank you. So moving on, we have got another question. Does sensitivity in the tooth go away on its own?
No.
Okay.
No. You have to use something. You have to use sensitive toothpaste, or you have to see where the problem is. Sometimes when people have a mild caries or a mild fracture, broken tooth also, they may be sensitive. So that has to be addressed. If there is a gingival problem, then that has to be addressed. So you have to see what the problem is, address that. Generally, they don't go on there.
Okay. So next question we have got: how to check the sensitivity in your teeth? What is the scale of your sensitivity? Whether you need to go and see it.
You want to know how I check or how?
In general, people can check it.
And when it comes to us, what we do is we isolate the tooth and we blow a jet of air. And that we can find out. Or we can use a scratch test. So we using a probe or something, we go from the mesial to distal surface of the teeth and see whether it is sensitive.
Understood.
This is how we check.
Right.
For people, it's more symptomatic.
Okay. So how frequently should teeth be cleaned?
It once again depends on your brushing style, your brushing technique, how much you maintain your oral hygiene. If it's good, then once a year will do. If it's bad, then once in 6 months.
Okay. When it comes to daily brushing, then in that sense, how frequently should people, like, for example, brush their teeth?
Twice a day.
Twice a day?
Twice a day. Twice a
Okay.
day. And after every meal, they have to wash their mouth.
After every meals, and specifically twice a day in general, and after every meal. So typically around 4 to 5
also should
days.
be added. Flossing also, if it's added, it's well and good.
Flossing also should be added. So why are teeth sensitive after specifically cleaning?
Okay.
After we finish the brushing of the teeth, why are they?
Okay. You mean cleaning at home or cleaning professionally?
Specifically, when we go and visit a dentist, then definitely we feel some kind of sensitiveness once the teeth are cleaned if we have gone for that. But even at home, sometimes some people might feel some sensitivity.
Okay. Main reason is you have clog build-up over the gingiva.
Mm-hmm.
So what happens is this attacks the gums, and there is a mild gum recession which has already occurred.
Mm-hmm.
Okay. And what is sticking onto your teeth? So after gingivitis is what is called periodontitis, wherein there is more damage and the tooth starts to shake.
Okay.
So in such a case, what happens is it's just the calculate which is holding the teeth.
Okay.
Once you remove it,
Yeah.
you see already there's a damage.
Yeah.
You're exposing the damage
Yeah.
dentin outside.
Yeah.
Happens.
Okay. So basically, I believe what you are suggesting is that the decay in the tooth or the erosion in the tooth has already happened.
Has happened.
Right. And when you clean the teeth, it exposes it to even more because the support of the.
So sometimes what we see is after removing the calculus itself, we see a zone of demineralization.
Okay.
Some people have decay beneath the calculus.
Oh, okay. Okay. So you never know. Go see a dentist and don't delay in seeing a dentist if you have got any sensitivity in your teeth. So we've got another question on the sensitivity, which is how often or do we see sensitive teeth? Are they very common or is there something very common?
Very common. The first thing, majority of the population who comes and see us, they have sensitivity. Even if you have mild caries, you may feel mild sensitivity. So that is nothing but demineralization.
Is it seen in some particular ethnicity or based on age groups or certain type of people?
No, not like that. In general, women are more susceptible.
Okay, understood. Yeah. So moving on, we have got question which about our general dental hygienes, and we have got a guest who has asked us a question. Prema, she says, is there any symptoms or warning signs that state that I am going to get sensitivity? Any warning signs of sensitivity?
Yeah, your tooth, when you see your tooth, whenever you brush or whenever you notice your tooth, you may have the haven't had faces.
Okay.
So that's actually not a warning sign. If you have that, you may get in the future.
You may get, understood. Or you may have some pain also in case okay.
Usually it starts with that kind of shock.
Understood. Right. So now we have got some of the general questions around oral hygiene as the second part of our discussion today is about oral hygiene in general. Then what can I do to prevent gum diseases, doctor?
Brushing regularly, taking care of your oral hygiene very well, flossing regularly, avoid build-up of clog around your gum lines. So when you do that, you can maintain good oral hygiene.
Understood. Okay. And how often that you should be brushing and flossing your teeth?
As already told, it's twice a day.
Twice a day, and after meals.
After every meal, you have to wash your mouth. Avoid taking high sugary foods. That can cause. That is what is actually the main culprit behind clog accumulation and decay.
Sugary foods.
Sugary foods. So you can increase having pulpers.
Okay.
And for a good gum health, you can have high vitamin C rich foods.
Vitamin C rich foods.
And during developmental stage, when the tooth develops, it's better to take high vitamin D rich foods.
Vitamin D rich foods. Okay. Right. So your nutrition, what you eat, has got a direct connection with the health of your teeth.
It has. Even water you drink has got a very big link.
Okay.
So there is something called as fluoride content of the water. That is an allowable or permissible level. So if you are going to take too less, don't to caries.
Okay.
And if you take too high, you can get something called as a fluorosis. That is going to be white or brownish discoloration of it.
Right, right.
Even that has a importance.
So where you're living, what is the fluoride level in the water also decides upon the dental health,
Yes.
right? Okay, that's something very interesting to know. So moving on, we have got. Are there any products that can help us with sensitive teeth? Anything in general, like is recommended any interdental, like you mentioned, some kind of accessories that people should use to help them with sensitive teeth?
Sensitive teeth, it's first thing we've already spoken about the prevention, the treatment,
flosses,
flosses and everything. And the next thing is about usage of sensitive desensitizing paste from the markets.
Yes.
And at home, we can give you specific remineralizing and sensitive preventive toothpaste. And at the office, we can give you varnishes, lessons, treatment, or a combination of glutaraldehyde and hydroxychloroquine.
Yeah. So you would need a number of things if you have got sensitive teeth. Go see your dentist, and they will be the right person to recommend you what suits best for you, depending upon the type of sensitivity that you have. So we've got another question coming in from Rabia. Rabia says, I've done RCT before 8 months, but my teeth is black in color, like stain near gum line of RCT teeth.
Okay, how long has it been black? That would be the question. Was the black discoloration right even before root canal treatment? Because that indicates a non-vital teeth. That is one reason why we go for root canal.
Okay.
If that is the case scenario, then we have to do a root canal, and then we have to proceed with bleaching and other procedures.
Understood.
So that should be.
And if that happened later on, then?
Later on, that's only that.
Okay. Okay.
That's it.
Okay. And she's asking specifically, is that an issue?
Based on if it's like they haven't placed a crown immediately after root canal treatment, maybe there is secondary caries also. That is definitely.
She's just mentioned it happened after.
It happened after.
Yeah.
Okay.
After she did the root canal treatment, the teeth got black. But she asked specifically, well, is that an issue? My tooth got.
No, it's better to check with the dentist.
Okay. Go see.
Because if it's going to be secondary caries or anything, then that has to be taken care of.
Right. So the doctor has to check what is exactly might be the problem. So go better see a dentist. Right? Yeah. Thank you so much. Now moving on, we have got what oral hygiene practices do you recommend for someone with braces?
Okay. The same as with the general population. The same goes. Proper brushing and proper flossing is needed. But here, in case of orthodontic patients, there are special orthodontic brushes that are available. So which will have indentation for the braces that you place, and you can brush regularly. And you also have flossers. Flossers, not only the wire flossers are there, you also have something called as water flossers, which are very helpful in every patient of every age group, and especially in orthodontic patients where you actually cannot individually clean every braces. So when doing orthodontic care, it's not only around the tooth which you need to take care of, the individual braces needs to be taken care of, the arch wire itself needs to be taken care of.
Right.
So it's
right. So there are different products specifically for people with braces. So go better see a dentist, and they'll be the one to guide you. But yeah, as doctor said, there are a lot of products already available in the market.
And even interdental brushes are.
Yeah. Right. So what is the best way to get rid of plaque buildup? Brushing often, and as doctor mentioned,
brushing and washing your mouth.
Yeah, washing your mouth.
And decreasing sugary substances. The intake of sugary substances.
Yeah, and junk food.
Yeah, and in between meal times, whenever you have food in between meal times, you usually forget to wash them.
So always remember to wash your mouth and do regular brushing after you eat anything. This is a very small habit, but people often forget about it, and it goes a long way in helping you have a long-term dental health and preventing any dental issues in future. So are there any foods we should avoid to protect teeth and gums, which doctor has just informed to us,
Yes.
right? A lot of foods like having sugary content and beverages and junk food, right?
And
So-
erosive acidic foods.
Acidic
foods in undiluted form.
Correct.
Like
Right.
vinegar, all you cannot have it in undiluted form.
Yeah. So, are there any special considerations we should keep in mind when brushing our teeth? Anything special we have to recommend? You just mentioned about horizontal brushing.
Yes, as a
Apart from that?
specific technique actually for brushing.
Mhm.
So whenever you brush, first thing you use soft bristles or medium bristles, and when you brush, it's the amount of paste that you take. So the paste can be depending on age group. For pediatric or very small infants, just a smear or a rice, a grain of rice size is enough.
Okay.
And for the next age group, a pea size
Okay.
would be enough. And adults can take an adequate amount, or even just a pea size would do for adults also.
Mhm.
And most importantly, it's not the timing, like the amount of time you brush. It's the
Okay.
technique which you use.
Okay.
And brushing just for 2 or 3 minutes per day is enough. I mean, per schedule is enough. And you hold the brush at a 45-degree angulation to the tooth, and you
Okay.
give an up and down motion
Mhm.
and a circular motion.
Okay.
So these both motions can be used, and after brushing the sides, open your mouth, and don't forget to brush the inner surfaces also, the occlusal surface, the topmost surface, the inner surfaces, up and down, all arches are important.
Right.
And more importantly, the last two, many people forget to take a brush. The brush does, they say it doesn't go.
Mhm.
Select your brush heads accordingly. Even the last molar to third molars have to be brushed at.
Right. Right. So that's a lot of insights for people. I'm sure this would be much helpful for people. Thank you so much, Dr. Pathumai. It was a wonderful session, and Doctor gave a lot of insights to us. Do let us know your questions, your feedback, your comments in the comments box below, and let us know if you have got any more questions for us. Like I told you, we have got a WhatsApp platform which you can use to ask your questions around any treatment, any concerns that you have, or you want to have any product recommendations. It's absolutely free of cost, and our healthcare experts will come back to you within few hours to answer your queries. So thank you so much, Dr. Pathumai. We hope to meet you soon.
Thank you.
And any parting words for our guests?
Okay. Take care of your oral hygiene well, because it also has got a link to your systemic health. Because many of you not have known, a bad oral hygiene not only causes the tooth to fall or bleeding gums or bad breath, things of that sort, but it also has a link to your heart, your lungs, brain, and everything. So studies have said that if you're not having a good oral hygiene, the bacteria from the gums can travel through your bloodstream. It can reach your heart, sit on your heart valve, and cause heart diseases. It can also reach your lungs, cause asthma-like problems, respiratory problems. For pregnant women, it can result in preterm labor, or an induced labor can happen. It also has recent studies have shown that it has got linked towards Alzheimer's and dementia and all those. And so hope you all take good care of your oral health. Thank you.
All the best. Thank you, guys. Have a good day.